Robert Johnson Wood Foundation and Robert Wood Johnson Foundation and the University of Wisconsin, which put out the county health rankings for every county in the United States. And Shawna Davie is a program associate with the Robert Wood Johnson Foundation, joining us on the telephone this morning. The newest report is out. The rankings are here. And Shawna, good morning to you.
Good morning. Thank you so much for having me, Todd.
It's good to have you with us here today. Indiana County, which is our primary concern here in Pennsylvania, Indiana County did not fare well in relation to other counties in the state. Shawna, what should we do when we get a report of this nature, whether we're one of the top-rated or one of the lower-rated counties in the state? Regardless of that, what is your design on what we should do with these numbers?
Absolutely. Well, that's a great question, and one of the ways that we like to think about county health rankings is like an annual community checkup. It allows us to start a conversation about what's going on in our local communities and to bring different groups, different organizations to the table, community leaders to the table, residents, parents to the table, to talk about the things that we can do to help improve our health. Every community is different. Every community has strengths. Every community has areas to improve in. But it really requires us to sit down together and have a conversation about it. And that's what we hope the county health rankings will allow communities to do.
And when you dig down into the numbers for Indiana County, for instance, a measure of what you're just talking about, under the quality of life, Indiana County doesn't rank well at 51. But when you look inside the numbers, you see that the margins are so slim between the top and the bottom counties there that it's not such a bad number to be 51 when you consider where all the other counties stand. However, there are other factors, and health factors is one area where Indiana County stumbles a bit. And we learn more about that by looking inside the numbers. And adult obesity is a problem here. Physical inactivity is a problem here in Indiana County. Those are sorts of things, those are preventable things, aren't they?
They are. They are absolutely things that we can do something about. And there are counties all across the country that are taking action. They are helping to provide more access to fresh fruits and vegetables to all members of the community. They are making it fun to get out and exercise, making it safe. Sometimes people don't have access to parks and sidewalks so that they can safely exercise and be outside. So those are definitely things that communities can take action on. I will say that in Indiana County, there are some things that are great. The high school graduation rate is really high in comparison to the rest of Pennsylvania, and it's continuing to increase. And so that's something to really be proud of. The number of alcohol-impaired driving deaths is continuing to decrease, and that's something we want to continue to see. So Indiana, Pennsylvania has a lot to be proud about.
Absolutely it does. When you look at those social and economic factors, that's one of where we are ranked in one of our higher categories. I want to talk about clinical care because that is where Indiana County has really struggled. And it doesn't seem to be about the quality of the care, but it really comes down to the number of, for instance, primary care physicians, the number of dentists available to the residents of Indiana County as compared to other counties across Pennsylvania. Again, those are numbers that can improve, but it doesn't really speak to the quality of the care that we're getting, does it?
Sure. I think that's a really great point, and we know that access to clinical care is truly important, but it isn't just about medical care. It's also about good schools, good jobs, and affordable housing. Those things play a role. One of the things that we know that really makes a big difference and is certainly a major connection to how a county is doing in terms of its health is the number of children in poverty. And that's an area that could certainly be improved in Indiana County, and it's something that we know makes a difference. The number of resources that a county invests in its children helps to extend the length of life. And that is really about access to food, access to exercise opportunities, providing support for families. All of those things help to ensure that the next generation is better off and lives a long and healthy and productive life.
Shawna Davie is with us, Program Associate with the Robert Wood Johnson Foundation, which has undertaken this amazing study, now in its 8th year, of every county in America. Shawna, if you could spend some time about the whys and the hows of this study.
Sure. Well, this is one of the things that we really hold up and really believe that it's important for communities to have information and data at their fingertips so that they can see for themselves what's contributing to good health or poor health in their local communities. And if you go to countyhealthrankings.org, not only will you find the rankings and the data, but you'll also find stories about what communities are doing across the country to improve their health. You'll also find our What Works for Health area that will give you information on policies and programs that can help communities think about what they might want to focus on first to help improve their health outcomes.
And one of the things that we can relate to from that standpoint is last year when the rankings came out, and again, adult obesity, physical inactivity were problems here in Indiana County. The institution then of the WalkWorks program, which is underway and which has really started to gather steam here in Indiana County. There are walking groups now here all across Indiana County that have really undertaken the job of reversing some of the more negative numbers.
It is truly incredible when community members are able to come together and to look at the data for themselves and think about what are the solutions that they can take action on. We want to lift that up, and we applaud Indiana County for the work that you all are doing in that area. It really makes a difference.
It really does. And when we look at those social and economic factors and some of the things that really will affect health overall, it points out that family involvement and community involvement, they're probably the biggest keys to becoming a healthy community.
Absolutely. You know, in the age of technology where it's so easy for us to be stuck to our laptops or stuck to our phones, having something like a walking group that doesn't just give you access to exercise opportunities, but also gives you an opportunity to connect with others. That helps to improve health as well. Our connection to other people helps to make us not feel socially isolated. It helps to improve our mental health. And those are things that we know have impact in the long run.
The methodology for putting together a report such as this, which is just amazing, and again, the website is countyhealthrankings.org, Shawna. Talk about how it was that you're able to gather so much information and then to turn that information into something other than just numbers, but actual information for us that we could use.
Absolutely. Well, there is certainly an amazing team of staff, both at the University of Wisconsin Population Health Institute as well as the Robert Wood Johnson Foundation, and the measures all come from national sources. So we pull information from a number of sources for more than 31 different measures, and we look at those across 3,000 counties in the country.
It must take an awful amount of time in order to do this. So the University of Wisconsin must really provide some resources for you to get all of this done. It's just amazing.
It takes so much work, but the real work is happening in community. It's really about the residents on the ground that are taking this information and, like you said earlier, putting it into action with things like those walking groups that are happening in Indiana. Those are the real stars.
Well, we're hoping that the numbers will improve and we can get up there around some of the other counties that are up there in the top 10. When we look at Indiana County in comparison to our other counties, Westmoreland County's right next door. They're number 16. Clearfield County is up in the 30s, I believe. But the others are down in our area. And so it really points out that it's not just an Indiana County problem. It really is, it has to have a regional approach to good health, doesn't it?
Absolutely. There are things that we know make up healthier counties. And we know that things like access to jobs, access to quality education, access to care help to make up a healthy county. We know that things like lower high school graduation rates or higher income inequality, higher unemployment rates sort of tend to lead to unhealthy outcomes and poor health for community members. So you're absolutely right. This really is about what's happening across the state, and how can we take information from other communities that are doing well in one area and share that with communities that may not have that as a strength, and vice versa. There are things that we can learn from each other across the state.
I think it's pretty interesting and neat about the site as well, countyhealthrankings.org, that at the bottom, after you digest all of the numbers and the data from your county, there's a tab, a Get Help tab. It says, if you're ready to take action but you're not sure what to do next, we can help you out. Then that's a great feature.
It is wonderful. We're so excited that our Roadmaps to Health Action Center offers personalized coaching and assistance and an online toolkit that can help communities to improve health. So if you're thinking about improving health in a particular area, you can go into what works for health and type in anything like adult obesity or any topic that a community is focused on, and find policies and programs that will help your community to begin that conversation.
She is Shawna Davie, the program associate with the Robert Wood Johnson Foundation, the originators of the County Health Rankings, which are now available, countyhealthrankings.org. Shawna, thank you so much for spending some time with us today.
Thank you. Have a great one.
You too. We'll see you. There she goes, Shawna Davie, this morning. And the numbers are really, they're eye-popping when you get right into it, because you can not only bore down on the highlighted sections, for instance, under health factors, adult smoking, adult obesity, food environment index, physical inactivity, and things of that nature. But then there are subcategories that will help you to dig down a little bit more. And when you look at, for instance, drug overdose deaths in 2016 as compared to the year before, you might think that it really jumped up. But unfortunately, it was a problem the year before as well. And so those are things that we continue to look at. Insufficient sleep is one of the ones that you can look at. And all of those numbers are broken down. And it's difficult to understand how they can do that county by county for every county in the United States and be comprehensive enough to make the numbers be real for us and maybe help us to understand how our health is affected by the environment around us. But they do a good job of it, and commend them for that. And again, recommend that you visit countyhealthrankings.org to learn more about it. It is Indiana in the Morning, presented by First Commonwealth Bank, AM 1160 WCCS, 101.1 FM.